If people knew what was best for them, then there would be no issues when it came to case presentation. Now, the problem is that the reason people seek out professionals is because they need our help and our information and our experience to be able to guide them on the right way. If everyone had the information, which they do through things like ChatGPT, through Google, then they would be able to make the correct informed decisions as to what they require. But the problem that we have is that we assume this knowledge. Now, rather than delivering value in a way that can be easily identified and dissected by the patient, what we do is we speak in our own terms, and that's the number one. As you guys know, my name is Waleed, right? I have a real focus on communication, case acceptance, business systems, and all that sort of stuff. We just wrapped up a 3-week live cohort program, which we probably won't run again this year. And so, last couple of weeks, being a bit busy, a lot of content coming out, but excited to announce that we do have the Dental Success Accelerator program launching soon. It's going to be 12 to 14 hours of pure content, the stuff that you're going to see through today, but even more in detail, structured, and I hope it's something that it's something that I really look forward to seeing all of you in very soon. What we're going to do, we're going to get straight into today's video. Okay, what I want to talk about today, like I mentioned at the start, is the elite protocol, the way in which you frame and you package treatment presentation to be able to convey value effectively. Now, what it's called is essentially the downward cascade method, right? And it's really the way in which you want to package and deliver so that the words that you're speaking are taken in the context that you want. Now, that's the problem, is that most of us assume context, but we don't create the right context. We assume that the other individual that's in front of us, the patient, is thinking the right things and thinking on the same track that we are. But the reality of the situation, like I discussed in one of my previous videos, is that patients generally have no issue with the treatment that you're proposing. What they have is issues with other areas in their life, right? And now all it is it's a ladder of different things that they're constantly weighing up against. And so now when you're delivering the treatment, majority of us, what we do is we think in terms of what we find important, and we never dissect what the other individual may find important. So that's why what we have to do when it comes to the presentation of value is come back to first principles and look at things from the lens of human psychology. Okay. And so that's why it's important to start comprehensive and work downward from there. The first step in this entire equation is what I call the do nothing anchor. So when it comes to the presentation of any treatment, right, the first thing that you want to do is you need to paint the cost of an action, right? You need to paint the cost of doing nothing. And what will happen if the patient decides that they're going to take a reactive approach, they're not going to do anything, and they're just going to go down the route of just waiting and seeing until things pan out. And so what you want to do here is you want to paint a vivid picture of an action costs, okay? Whether that's a financial anchor, a time anchor, a pain anchor, it doesn't matter. All of the information that guides the way in which you communicate these things comes from your initial conversation, right? And your pre-discussion before the consultation or the examination, in which you actually dissect and you talk and you continue to question certain things so that you can extract the required information, because that information is what will then guide this conversation that you have at the end. Now, one of the biggest problems that I see dentists make, and not just dentists, but even other medical professionals in other areas of life, is that they assume that building rapport is something in which they have stupid conversations about irrelevant topics. One of the frames that I want you guys to put yourself in is think about any time that you've ever gone to a medical specialist, someone that's extremely high in their field, and when you've interacted with them, when you've gone in for a consultation with them, when have they ever gone into real depth about how your day was, what you do for work, what you do, all that sort of stuff? That's the common misconception, is that people think that being overly friendly is how you build rapport. But the reality is that people see you as a professional, and what you need to do is you need to build trust through developing that professional image. Okay. And so part of that initial conversation is not to ask them questions that don't guide anything that you're going to do later on in the consultation. But what's important is to guide questions and continue to click down on questions that are going to give you more information that will add to the context that you're going to build. And so the doing nothing anchor is really important, because what you're doing is you're basically taking all of that information, right? You're painting a vivid picture of an action costs, and you're doing that in the cost that is going to be most valuable to them. That's why some people have issues with time. Okay. They might have the money for things, and they might have, no issue with the pain, but they're very limited in time. They're traveling, they've got commitments, they're not in the country. And so that's what you're battling with. And if you try to frame it in terms of finances, which is what most people do by default, then by default, you're not even in the race to win, because you're completely on a different page whereas their priorities are on another page. And so that's why it's important to make sure that you're talking in the right terms when it comes to this actual conversation of doing nothing. But the most important thing here is basically before you get into the actual options, what you want to do, the first thing that you want to create, the first image that you want to create is the cost of inaction. And so what this looks like is you creating this picture of the time, the finances, the pain, the commitment that will be required if they decide to take that reactive approach. And so what this can look like is like, look, the first option is that we do nothing at all. We leave it, right? And we can see how it goes. There's absolutely nothing wrong with that. But the problem is that if we decide not to do anything, right, then the ball's not in our court anymore. It can break or it can crack whenever, and we have absolutely no idea of what the options are going to look like after. So what right now could be relatively easy, simple, quick to fix, right, and relatively cheap as well, could end up being something that becomes costly and painful. And so if we have to address this when it starts to become painful, it means that a nerve is involved. If a nerve is involved, it means that we have to do more complicated, expensive procedures like a $6,000-$7,000 implant, or a root canal and a crown that will require a referral to a specialist, right, which will require multiple visits and probably be a little bit of a painful experience that might require a little bit of recovery time. So what you're doing now is that everything that comes from beyond this part of the conversation will be compared in relation to this initial anchor. And so that's when you lead in with the second thing, which is the platinum standard option. Okay. And that's when you lead into what you call the ideal, the platinum. Okay. It's the gold standard. It's the thing that you want them to compare with, because now that you've created this image of you doing nothing, now the first thing and the next thing that you want them to hear is the ideal thing that they want to do, because that's the first thing that's going to click in their mind. It's going to sound, in comparison to doing nothing, like the best thing to do. And so in this situation, what we're talking about is things like doing a crown, or if it's something more comprehensive, it's something like doing a full mouth rehabilitation. So after you've done the do nothing anchor, what that can look like is something along the lines of, now that you've understood a little bit about what not doing anything looks like, I'm going to run you through the options of what ideal looks like. And so the main downside of the best option is the fact that it's quite expensive and it's been an investment, but the advantage is that we don't have to predict. We can plan things properly. We can basically, almost guarantee that the tooth is not going to be painful. You're not going to lose a tooth. Okay. It's the only way that we can prevent you from losing the tooth, because it's the only way that we can guarantee that we put something protective on it before it ends up taking on too much force. And so what we're doing is we're being proactive. We're keeping the ball in our court. And what that's going to allow us to do is it's going to allow us to be in control. Okay, it's a little bit more expensive. It requires a bit of an investment, but that's sort of the price that we pay for being in control. So even here, I don't go into, the numbers unless the patient asks, right? If they ask, you can go into these numbers, but then you go straight into, the next comparison, which is the next point in which you go down the stairs, right? Which is where you go to the guarded option, or the option that you don't want to talk about. And so in the context of something like a crown, what you're talking about is a filling, right? And so the natural transition from that can be something along the lines of, now that's the ideal, right? Now, in terms of the compromised option, the option that is still available, but I wouldn't really consider it too heavily, right, is to do just a patch up or a filling. Okay. And so what doing a patch up or a filling will do is that the only advantage is it's a bit cheaper, right? But it doesn't fix any of the issues that we discussed. All it's sort of doing is kicking the can down the road. And yes, it'll fix things temporarily, but the risk of losing that tooth, the risk of fracture, we haven't removed that. And so if that's what we're going to be looking at, then it's best to go down the ideal route. Okay. And so that's where you basically leave it at there. And what you've done now is you've got your anchor, okay, and you've got your ideal, and then you've got the thing that you don't really want them to do. Okay. And so within those three options, it's obvious that one thing is going to be the best thing for them, right? And you've done your due diligence in giving him all the options that are available. Now, a commonly asked question is like, how do we go into this conversation when there's a lot of different options? And it's the exact same in that you always go through this in terms of a dichotomy between just one or another. And so what that can look like is, for example, if you've got multiple different things, or if, for example, you're talking about implants or you're talking about missing spaces, that looks like something along the lines of like talking about fixed options versus removable, and then within fixed, talking about tooth-borne versus independent, like dental implants. And so it's still keeping things very simple, straightforward, and it's making them choose between A and B, right? And it's presenting the options in a way in which you are the one guiding the conversation. And that's what's crucial here, is that you, being the professional, you know what is going to be best for them. And so what you have to do, and what your job really is you're being a facilitator or a guide to them coming to the conclusion that the ideal option is the best option for them, okay, regardless of what the cost is. The problem that most of us make is that we make things about the cost from the get-go, when our job is not to even consider the cost, because when, for example, we go to a medical specialist, the cost is a side piece that we have to consider and we have to figure out for ourselves. The main job here is to give the information, and give the information in an unfiltered, raw sort of way, in which we're just giving the information and guiding them to what is going to be best for them. And then after that, if they start to question into the finances, then you can have that discussion with them if it's required. But you need to be aware that if you make things about finances or about insurance or about certain things that, especially if the patient hasn't brought them up, then you're the one that is sabotaging yourself in regards to all of these conversations. The advantage of this dual alternative is that it creates the binary choices. Okay, it builds yes momentum. Like I said, it builds more momentum to what you deem to be the best outcome for them. And the last thing is that it gives closure in the appointment right there. So once you lead them between A and B, and then another A and B, and then another A and B, at the end of that conversation, you've got a final choice, which is what they want to proceed with. And that's when you go into the nitty gritty of what the cost is going to be. And the crazy part here is that once you start to do this, the majority of people don't actually backtrack, because now that they've gone through this A and B process with you, they've realized that, they've come to the outcome independent of the cost. And so if they backtrack on there, they're almost going against their own decision to choose to come to that outcome. Okay. So what that might mean is maybe they'll put off, the ideal option for a little bit longer, but they won't have compromised treatment in the interim, right? They'll just work towards getting that ideal treatment. But the more important thing is that now they've realized that that is exactly what they need. And so that's what's going to allow them to move ahead and actually end up doing the treatment that you've recommended. And that is going to be the best for them. Now, a couple of things that I want to touch on here in regards to the psychology of money and scheduling, right, is that number one, is the mindset of money. Your degree of comfortability with money will dictate how comfortable you are talking about money. And so if you're not comfortable with your own finances, if you've never made purchases over a certain amount, it's going to be very difficult for you to talk beyond a certain number. I think personally, based off experience, based through assessment, through investigation, through seeing a lot of different practitioners, some at the lowest levels and some at the highest levels, communicate, I think one of the things that I've noticed is that majority of clinicians will defer detailed financials to a treatment coordinator or a practice manager. And so that's what's important, is that don't in the chair get into the nitty gritty details of all the different payment plan options, and they can go through this finance company or this finance company and all that sort of stuff, because that's not your job. The logistical challenge of coming to a financial agreement is the job of the front office. They should be the ones digging into the nitty gritty of what the financial arrangement is going to look like, whether that's upfront payment plan, split payment, doesn't matter. That's not your job. Your job is to make them aware of the ballpark, give them a range. And so for bigger cases, the important thing is giving a range. So, it could be anywhere from something along the lines of, look, if you want to get into, more comprehensive rehabilitative work, we're looking at in the range of $20,000 to $30,000. Is that something that you think you could comfortably invest into something like this? And so that then allows them to have an understanding of what it's going to take. But it means that you're just giving them an idea to lead the conversation there, if it is something that they're open to. And if they're not open to that, or if it's something that's completely off the table for them, then you don't waste any more of your time or energy going down into that conversation. Now, the underlying principle here for both yourself, for your treatment coordinator, is that you can never assume financial capacity for anyone. You never know whether the person who you've already deemed as not being able to afford something has actually the ability to afford what you're presenting, and you yourself are the one that's going to sabotage the outcome. And so, have the conversations regardless and independent of what you think the financial situation is going to be, because every single patient has a right to know what is going to be best for them. And you have to reframe your job as the facilitator to what the ideal option is going to be, the most definitive, the most long-term, the most conservative, not just in terms of conservative on the spot, but conservative in terms of the number of times that the procedures have to be redone over a longer period of time. Yeah, take these things into consideration, okay, and understand that, the money mindset is crucial to handling these money conversations. If you can't do them, then structure your conversation of presentation in the way that I'm talking about, and then leave the money conversation to someone that is comfortable. In terms of scheduling, seize peak motivation moment, okay, and cash in on fresh micro commitments. So that's what I was saying before, is that being able to get them to an outcome and a decision at the end of that conversation through the binary choice and through the downward cascade method is one of the best things about it, is that then they don't have to, and they can very rarely at the end say, I need to go and think about it, or I need to go and discuss it further, because they've already come to the conclusion that that option that they've ended up with is going to be the best for them. So it's, like I said, very hard to backtrack from there. After that, it's more of a conversation of whether it's going to be something that they can invest in or not, based on finances, based on time, and based on other things. And if you've done your job properly in that downwards cascade method, then even that will be sort of managed if you've had those conversations openly throughout the process. With scheduling, the most crucial thing is just making sure that you have some sort of commitment, some sort of appointment. So just make sure that you eliminate friction, right? And you ask for the next step. Don't leave it up to anyone. It's up to you now to make sure that you get some sort of micro commitment and you get something locked in, and you pre-frame that and you wait for pushback. And so what that means is something along the lines of, great, okay, now that we've been able to figure out what's going to be the best for you, I'm going to hand you over to my treatment coordinator. She'll take you through the financial side of things. And then what we're going to do is we're going to book you in for an hour and a half in 2.5 weeks from today to get started. Does that sound okay? All right. And if they push back from there, then you can manage the objection as it comes. Now, what you've done is you started to move towards a future appointment, and they either commit or they don't commit. Okay. And so that's what you have to handle then. So just to summarize, the success formula is, you need to build authentic relationships. You need to curate the right mindset before clinical discussions, right? It's important to present a clear hierarchy while preserving your autonomy. Okay. And like I've said, your goal is to guide and recommend and facilitate the flow of information from a professional, i.e. yourself, to someone who's not as informed as to what the best outcome for them is going to be. We as humans by default choose things like time and money and energy and pain to dictate what choices we make. But we also sort of understand that the things that are best for us are usually more expensive and usually more painful and usually require more time. And so regardless of what it's in, whether it's in your career, whether it's in work, whether it's in getting treatment, whether it's, social relationships or physical health, the majority of the time you have to move towards discomfort. And so getting people to commit to the things that are going to be best for them is almost a practice of getting them to move through the discomfort of getting through the financial hurdles and the physical hurdles and the pain hurdles, the time hurdles, and all that sort of stuff. We by default do not want to do these things, and that's why it's important to see yourself as a facilitator to help people move through these hurdles that exist by default as a result of our own psychology. So now what you've got a clear method, you've got a formula that you can use to be able to talk to people in terms that they understand, so you can meet them where they currently are rather than just doing things in the way that you think is best. You can frame yourself to be the individual who is going to lead people down the road to discovering what is best for them by giving them the right information and by facilitating a decision-making process that is very simple and binary, rather than overcomplicating things and rather than giving them an abundance of information and then still leaving it for them to decide. They have come to seek help from you to be able to do your job and give them advice on what is best for them. The natural reflex reaction when people get hit with high numbers and high time commitment and high time pain and higher pain commitment is that they will automatically want to move away from that. But it's your job to frame and handle that conversation so that it's something that can be managed and understood and accepted, so that the right steps can then be taken to move into the treatment phase and get your patients closer to the outcomes that you've talked about. That brings us to the close of today. If you've enjoyed the video, if you've gotten something useful, if you're going to apply it, drop a comment, let me know what you think. And if you're interested in talking further or looking more into these communication methods and protocols and a whole bunch of other stuff when it comes to business systems, efficiency, and overall treatment planning protocols, then there's a link in the bio for the Dental Success Accelerator program. 12 to 14 hours plus of live recorded content on all of these different things that we've discussed. Have a look. I'll see you in the next video.